Hello everyone, you're welcome to my YouTube channel. I'll be discussing very important parasitic protozoan disease known as Giardiasis. Giardiasis is an important parasitic protozoan disease among children, the elderly, the immunocompromised individuals, and where untreated surface water is used as source of water for drinking. What is the etiology of giardiasis? Giardia lamblia is the etiological agent or the causative agent of giardiasis. It exists in two morphological forms, the trophozoite and the cyst. The trophozoite is found attached to the intestinal cells using the concave sucking disc. It moves around with flagella, while the second morphological form is the dormant cyst, which can be found mainly in the stool or feces of human carriers. The epidemiology of giardiasis shows that Giardia lamblia is a cosmopolitan parasite, particularly common in the tropics and subtropics. It is transmitted through the ingestion of contaminated food, mainly salad vegetables, such as improperly washed cabbage, lettuce, carrots, tomatoes, or even fruits. While consumption of contaminated water is the main means of transmission of Giardia lamblia to humans, or person-to-person spread by the fecal-oral route. The source of infection is mainly human carriers who shed Giardiasis and may be asymptomatic. They may appear as apparently healthy. The persons at risk of acquiring or contracting Giardiasis include 1. Children in daycare centers where the diapers are changed. The caregivers may be infected in the process while changing diapers, or they may also aid in the transmission of giardiasis if hands are not washed properly between diaper change among the children. 2. International travelers. These are tourists who may want to swim in surface water that may be contaminated with cysts of Giardia. And in the process of swimming, they may sip this water and become infected. Also, persons who drink contaminated surface water, they don't have access to treated municipal water supplies, are at risk of contracting giardiasis or acquiring giardiasis. Immunocompromised individuals whose immunity is lowered may also be at risk of acquiring giardiasis. What are the clinical features of giardiasis? Symptomatic giardiasis depends on age and immunological status. the young and the elderly whose immune status may be weak are more susceptible than agile, healthy adults. In children, the symptoms include watery diarrhea or pale, greasy, semi-formed stool, which may progress to severe fat malabsorption syndrome. Among older patients who may be immunodeficient or immunocompromised, the symptoms include flatulence, foul-smelling diarrheic stool, abdominal distension, and epigastric pain with fat malabsorption or steatorrhea. The laboratory diagnosis of giardiasis involves the collection of at least 3 stool samples before a negative result is reported. The routinely used method involves the direct wet mount saline preparation, and under the microscope, the trophozoite can be seen. In a closer look will appear as if an old man's face is staring at you. Other diagnostic procedures include the use of trichrome stain, where the 4 nuclei can be seen in the matured cyst. Enzyme immunoassay can also be used. This may involve where you have large samples, or for research purpose, direct fluorescent antibody assay, which involves the use of an detection of an antigen prepared from Giardia lamblia. It can be used without concentration method. Then the rapid immunochromatographic cartridge assay too can be used. Here you have plates of cysts of Giardia lamblia. The first one is the unstained cyst, and then you have the cyst stained with iodine. The next is you have plates showing trophozoite of Giardia lamblia stained with the first plate there shows trophozoite stained with trichrome. The second one shows dividing trophozoite stained with trichrome, and the third one plate shows cyst stained with trichrome. Prevention and control involves boiling of water, which may be regarded as unsafe for drinking, filtration of water using a muslin cloth, especially in rural settings where municipal water supplies may not be available. So water, either rainwater, surface water, should be filtered using muslin cloth. Personal hygiene involves the washing of hands, especially after using the restroom or toilet facilities. And anyone involved in swimming in contaminated surface water should not swallow water while swimming. Well, the drug of choice is metronidazole, or commonly called flagyl. Here are selected references for further reading. Thank you for listening.